Give me the thumbs up when you're ready.
We got one more.
He's here.
All right.
It's 6 o'clock. You're right on time.
Thumbs up. Okay. Welcome everybody to the Platte County Health Center. It is time for our monthly board meeting. It is 6 p.m. on August 20, 2026. So let's do our roll call. Susan.
Present.
Ken.
Present.
Me, present. Mike, present. And Zach says he's going to be a little bit late. Okay, let's stand and do the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so do we have any special guests or public attendees that we should be aware of? I believe we do.
We have one guest, and he will be speaking later, but this is Kenny Hales, our auditor.
Very cool, very cool. All right, welcome. All right, and then I guess minutes. Has everybody had a chance to look at them, review, approve, all that fun stuff?
I've reviewed the minutes. I move we accept the minutes as written.
Okay, we got
I'll second.
Kim second. Any further discussion? Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Okay, done deal. All right, let's go on to the audit then. Kenny, you're in.
Thank you again for allowing me to do the audit for the organization. A lot of what I see is a lot of the same things, repetitive as far as income and expenses. You want to flip to page 14 in your audit, in your report. I will say though, thank you, Dr. Kingsley, for no one's ever said Kenny Hales auditor very cool, very cool. That is pretty sure it's never happened.
Yes,
Next time it's 3 very cool.
very cool, very cool, very, very cool.
That's more than I get usually get.
Okay,
All right, so your change in net position or your net loss for the year, a small loss, which was not totally unexpected because your programs that you had during the year were down. So you were finishing up programs that were funded mostly in the prior year. You just didn't have anything to replace them of equal value. So that brought everything down, on that side. I always want to point that out because this, especially in your organization, the programs don't run from January to February. They run from March to March, June to June, that sort of thing. So a lot of times your timing makes a big difference on your bottom line, what your expenses are. The salary side obviously is the biggest piece that you do, and I'm pretty sure everybody in your organization would not make less than they did the prior year also. So that's you're always chasing inflation and that sort of thing on that side. So not to be alarmed by anything you see there. If you flip back a page, your statement of net position, your balance sheet looks pretty good as far as that goes. You've got your long-term payable on the building that you're making good progress on. Your cash flows are good in that regard. So nothing in danger that way. As far as the records, everything's in pretty good shape that way. Michelle's able to give me any information that I ask for, and if there's any questions, I was trying to throw for a loop or something. And she always calls me out on it. But everything looks pretty good that way. You did have a question on the accrued compensated balances, and I will get you an answer on that because I did not know off the top of my head what that bottom figure is.
when I was going through it, I was like, I understand the vacation, the compensation, but I was like, for accrued expenses for absences, I didn't quite understand what that would be. So that's what begged the question.
So I'll get you an answer on that. But that's really all I've got. Nothing alarming. Nothing stands out as that you need to do different or anything of that nature. So I always tell you if you have any questions, if there's something else you want me to address, be happy to come back and do so, or just shoot an answer. Or question Andrew, and I'll get back to you.
Let me ask you some questions I asked you tonight. Is the way the information is transmitted to you in a format that is most efficient to decrease our potential future costs of the audit?
Yes and no. The information that's provided is fine. The cost for me is really based on a couple of things. One is, do you have a single audit need, which you did not this year, because the money from the feds is now under $1 million. So that reduces your bill a little bit. The problem with that is, as I mentioned, like with the salaries, the cost of my software tripled this year. So you'll get to enjoy part of that next year, but it's on to bigger and better things, as they say. So, that'll get spread out amongst everyone. But
The crux of my question essentially is, are our procedures and how we're obtaining the audit most effective, cost effectively, so that is there anything we can do to save our taxpayers a little bit of money in the audit situation?
not really. Like I say, we're doing everything electronically that we can do that way. I don't really charge. I charge a flat fee for the whole process. I don't charge it.
I know.
Good steward of the money.
So I'm just trying to see if there's anything we can do as a board to improve the delivery of information
I get you.
and save some money.
And I will say, I've gotten lots of requests from other health departments to, like, who are we having to do our audit? We are not spending nearly as much as some others.
I agree. Yeah, I still feel compelled to see if there's a way we can save some money.
And I think part of that, honestly, is the relationship that we've had with Kenny over the years. And particularly you and Michelle.
Yeah.
And the consistency that we've had back and forth. If you were having to start from scratch every year, it probably would not be as streamlined as it is.
It would be accurate. I do a couple of small health departments far north. I've been asked to bid on ones around here, and I've not chosen to do so. Mostly because, for the same reason Andrew said, I'm familiar with this organization. I'm familiar with the people that work in it. That has a lot to do with it. I could tell you some stories that.
AKA stay with me and your price doesn't go up. Love it.
You're always
Love it,
welcome.
love it, love
You
it.
should always bid it out. I will tell you that. You should always bid it out, and then you can decide for yourself.
Thank you.
Were you saying, I didn't mean to be, that there may be a little bit of an increase next year based on your,
Yeah, but like I said, I'm trying to, as Dr. Shaw said here, I'm trying to figure out how I can streamline it as well.
okay.
From that. So, triple. Okay.
That's industry wide. Everybody's getting the same.
No, I'm a single person. So when you're splitting it amongst one, it doesn't divide very well.
Right.
So it's hard to swallow if your audit practice is 20%. My audit practice is probably 80%. So we'll see.
Any other further questions from anybody? Concerns? No. Okay, so we have to approve the audit, or what do we need to do? So we need a motion to approve the audit.
Move to approve the audit as presented.
We have a second.
I'll second that.
Any further discussion? Okay, Susan?
Yes.
Okay.
Yes.
Me, yes. Mike?
Yes.
Zach? Yes. For what you heard?
What he read?
That's part.
All right, Ken. Thank you.
Thanks very much. Appreciate
Thank you.
We'll see you again next year, hopefully, huh?
Yeah, thanks.
Thank you, sir.
Okay, so what's next on the agenda? Tax levy, is that what's up?
Yeah.
Okay, do your little spiel and let's see where we go.
Sure. We met, the finance committee met this past Tuesday at 2, and yeah, maybe 2:15, 2:30 when people showed up. Yeah, all of us maybe forgot about the meeting. So a few of us. But probably the main thing on our agenda was the tax levy and discussing that. And this is fairly familiar. We've done the same thing about the last couple of years from what I remember, being that the the amount of property tax revenues budgeted for 2026 is 0.0722 per $100. It's been approved for the 0.08 per $100 assessed, and we've done that. But with the Hancock rule, it goes back to 0.0722. People say, well, can we go up? If we're running a little low on money at the health department, can we go up more? That would take a vote of Platte County. It'd have to be on the general ballot. So even though we want more money, we are okay with the point. We don't want to kind of ruffle our edges and put a vote out there that we may get downgraded to be less. So we went ahead and said we want to propose that we go with the 0.0722 per $100.
So the question I had, and hopefully you know the answer to this, is it been 0.722 for multiple years in a row?
I think like 4.
Yeah, since
So,
we've been here.
but the property values and the assessments have just been skyrocketing. You would think it wouldn't be 0.072, it would be like 0.721 or 2. Or why does it keep staying the same with the property and all that? Because how much money we generate extra upon what we had from that? It was like 127,000 or something, right? Or am I off by that?
I don't know the whole formula of the Hancock Amendment, and I could learn more about it to give you an answer. But it has to do about, it can only go up so much, and it's only based on like the new construction.
Right.
It can't go up a certain amount. It can't go up more than a certain amount on all the existing.
But I would say when they recalculated that, it would actually go down, because Platte County is just hand over fist of money. It's just, I saw what the assessment was, something like, was it like $200 million extra this year compared to last year? It's crazy.
So it's not going to go down because we're going to continue to have to serve more people.
No, I'm saying that the Hancock Amendment, when they recalculate, that it just seems weird to me that it's the same number 4 years, like you said, 4 years in a row. You would think there would be a little bit. I don't want to lower it. I'm not saying that. I'm
Would
just
our
saying,
lawyers be able to?
it just seems that it's
Yeah,
almost
Jim
artificial that it stays
tell
the
us.
same so many times. They should have adjusted a little
They basically
bit.
plug it into a formula and it comes back to what it is.
Right.
But yes,
Well-
it is interesting that's the same.
It
But I
just,
can have Jen explain it to us at the next meeting if you'd like. I just don't know it well enough to exactly tell you.
right. I guess my question is, are they not trying to zero out the gain that you got? They're not. If they're keeping it the same, then every year you're going to make 127,000 more than you did the year before.
They're just trying to limit how much so there's never a windfall is
Right.
basically
Right.
what it is. So every year we're getting like it roughly is 150 to 190,000 more.
Right.
But it's never this big windfall. And that's what the Hancock Amendment is always trying to do, is that you're never getting more money than your expenses.
Mhm.
So you're never bringing in some kind of big excess cash flow.
Yeah.
But I can have her come in. and
Am I right saying this though? Do you guys see the same thing what I'm talking about, or am I just blathering here?
Well,
It just seems weird that it's almost artificial that it's stuck at 0.722
I know, yeah.
when when everything else is getting higher and higher and higher, and they're saying, oh yeah, it's the same.
So they interject the consumer price index into it, and then how much new construction but sorry, Dr. Schotter.
It's a 4.4% increase. So if you look at the 127,000 compared to our total revenue of 2.9, it boils down to a 4.3% increase over the previous year. Platte County continues to grow at a faster rate than most other counties, and we're proposed to have another 3 to 4% increase by 2029.
Exactly right.
If I think. And so we're growing and we're going up each year.
Like $200 million in assessed values every year. That's crazy.
Well, I know.
But just to have it so precise at
Property.
0.722, and it stays that for 4 years straight. It just, like I said, it seems artificial. Like I would expect it to go to like 0.721 or something like that. And the fact that it stays the same.
Jen kind of maybe explain it to us
That's fine.
a little bit more.
I'm not saying we don't need to decrease it, or I'm not, I'm just
I got
saying,
you.
I'm just looking at it as,
I
you know,
got you.
yeah. Okay. Any further discussion, thoughts, concerns? Everybody gets a say here.
It just seems like a lot of it's out of our control.
I can't support a decrease in the rate while we still have a balance due on another.
Yes,
I agree.
I agree.
And I don't believe an increase is appropriate. So having,
So this is actually the discussion we had. And I was telling Susan, I clearly remember our first discussion, the first year you were on the board. And we had all the, and at that point, our ledger book said we owed $5 million.
it did.
And it was an interesting discussion. And we were, everyone here, especially at that time, 3 new members on the board, were trying to figure out, and you've been on the board 4 months at that point, maybe, and trying to figure out what our cash flow situation was and where we were at. And we were discussing, you know, potentially lowering the tax levy. And I just remember thinking, oh, we're just not really in that position
No.
to be able to do that. And since that time, you know, we have these reserve funds and these reserve accounts that we are also trying to fund and different things. And Dr. Kingsley and I were talking about those today as well a little. So I completely agree. We're not really I'm not supportive either of an increase, but I do feel like it's pretty important that we keep it the same to support the work we're doing.
And correct me if I'm right or wrong here. If we lower it this year, because it's assessment year or whatever, then that's when they do the recalculation.
Yeah.
But like next year, not saying, but let's say next year we wanted to drop it to 0.721 or something. It would just be a 1-year decrease and then it would bounce right back up the next
No.
year.
You'd have to go to a
You
vote.
have to vote. It has to be on the ballot.
We
For the-
have
And we, the Board of Services.
dealt with this 2 nights ago and were presented information that wasn't consistent with what was just presented. And that the assessment years, if you lower it that year, it locks it, but if it's a non-assessment year, you can lower it until you hit an assessment year. But if the rate is lower during an assessment year, it can be locked down to increase it past that. So we actually have asked for a legal opinion.
Yeah, we're gonna have a lawyer tell us what we can and can't.
And we'll have clarity on this based on another entity in this county.
Okay. But, yeah, that's
Okay.
As
not
long
my,
as we don't lower it, we're good.
This year, yeah.
Yeah,
That'd be a
and
bad
I
idea.
can't see anything that supports lowering it.
Yeah.
We should have, we've been expensing roughly about how much per year for accreditation? I think it's been running around. How much?
so probably altogether $150,000 probably
Total?
with the staff and the,
Yeah, okay, so,
but some of it's being, like, this year we have a contract for $220,000 that's paying for it. So,
right, oh gosh, I forgot about that.
so,
Having said that, I think we're gonna be in fine fiscal shape next year.
So the uncertainty is if we did decrease it this year, we don't know how they would recalculate. We don't know what the tax rate levy would be next year, what they present to us from the state. It could be a disaster.
my understanding is that you have to go back once you mess with the form.
We literally read the statute 2 nights ago.
We had this
And the
argument.
statute reads, a lot of it has to do with an assessment year. If you lower it during an assessment year, it locks it down. If you get any increase after that, you have to increase it. If it's a non-assessment year or an off year, you can lower it temporarily, but during an assessment year, if it's lowered, it locks it, and to get an increase, you have to increase it. So that's at least the way we read it 2 nights ago, and we've asked from the other committee that some of us serve on we're expensing a little bit of money to get a legal opinion.
Well, I
Benefit
guess we'll
from
get
it.
our legal
Yeah.
opinion.
And I'm not trying to lower the tax rate. That's not what I'm trying to do here. I'm just saying it's,
We're just trying
we
to
need to know the
understand.
background. And
I
then
need to
it just
understand
seems so weird that it's 0.722
better. No, it
4
has
years
been that
ago.
way.
It's like nobody's
I know.
at the state's recalculating this with all the extra revenue we're making. And that could be accidental or maybe intentional. I don't know. But it is another extra $127,000 that we're gonna make just by not changing anything. That just seems weird.
But that does cover an inflationary increase.
Yes.
I mean, it's,
Inflation could be 3.5%, we're at
Cost of living.
4.4%.
which
So,
we also have more.
so I'll say
citizens
it
in
barely
town.
covers our
I was gonna
inflation.
say, yeah. Sounds like.
Okay, anybody else have any further discussion? And then I guess somebody has to come up with an idea of what they want to do.
I would make a motion with potentially the same.
A second.
We have a second, any further discussion? Okay, Susan,
Yes.
Kim.
Yes.
Me, yes, Mike,
Yes.
Zach, yes, it's a done deal. And then hopefully we'll have clarification in the future.
Yeah.
That's it.
You know, it's bad when I have to take 5 minutes to read 3 emails today from that other.
Yes, yes. All right, go ahead, run the show.
So my report just, we have dropped off a little on our birth and death certificates from 2025. So Cindy, I don't know what you and your people have been doing. No, it's still pretty busy, but not quite as busy. I think like 50 people less and about 500 fewer copies, but still quite a bit more than previous years. So people are still coming into the building. Still working on our HVAC, but we are, I believe, almost ready. Next week, we should be sending our letter to Straub and the Hales, telling them what we think is wrong. Of course, if you notice outside, it's really nice outside. It stinks that it's nice and cool. It's really hard to diagnose when it's nice and cool. But we do pretty much know what's wrong. We have some economizers that are not working right, and the duct heater in here has not worked at all this year. So, but at least we know that.
And the, so the duct heater in the summertime, that would burn off the humidity, is that double function?
Which is actually why you hear the humming in the back.
Is that what
We
was
have-
just put in?
Yes.
Okay.
So it's clearly under warranty. The other ones are working, but this one is not. And hopefully it's a wiring issue. I don't know if you remember, but we had heating issues over this winter where there was, like, we were freezing.
Right.
Yes.
And they were insistent that Taylor just is a whiner. And well, that might be true.
Oh, hey.
It was really, really cold.
Yeah.
And there was a wiring issue with the thermostat.
I'm just glad her attorney didn't.
Yeah.
So hopefully it's just a wiring issue that they can fix. I won't say too much about it because I'm sure Taylor will talk about it, but we have the 27th annual back to school fair. And here's just some pictures. So hopefully you saw that in my report.
Where, was that held here or where was that actually held?
Held here, and there were a lot of people here.
Why do you have the creepy camera pictures from
Was- I
security?
wonder if that, the dude I was telling you about, I wonder if he was there. That sparked the whole conversation.
Could have been.
Because I think it was a back to school affair thing. Oh, never mind, it's still totally separate. Keep going.
So our budget overview, because you didn't get enough of that in the audit,
Mm.
but we are at 58.3% of the year. Our revenues are $3,329,470 or $470 or 79.6% of our total budget. Our expenditures are at $2,287,658 or 54.7%. So almost exactly in line with where we're supposed to be. Our money market account balance, we are at $1,641,772. That doesn't count the $250,000 CD. I just advised Ryan at Nottaway Valley that we would be cashing out that CD in August, so it'll be coming back into that account. Because we'll may not necessarily need it, but if we did, we would not be interested in paying any penalties. And I think, Cindy, do you recall? I think we made like 5,000 something on it. Did you see it, Susan?
Yeah, but it was 5,000 something.
And change.
Yeah.
Did she have it in front of you?
It's somewhere.
Okay.
It's somewhere.
What's the length that they want on these? They want us to do 4 months or 6 months?
We did 7 months.
7 months, but do they want us to do shorter? Are they still trying to entice us to do that?
She didn't talk about it, and because we're at the end of our year, we didn't really discuss doing another one at this time.
Because I remember I came to the one meeting months ago, and they were saying if you do a 4 month, you get the higher interest rate. If you do this, you get. Remember that?
Yeah, but why?
Shorter ones are the higher interest.
Right.
Right,
But I don't know
think
if it all-
we went to the safe one. I know that.
Yeah, at the time 7 was, it changes. At the time 7 was the
Yeah.
And it
premier.
may all even out in the wash. It's all probably the same anyway. But
Yeah.
Still.
For our lease purchase, we are at $2,013,717.
Almost at 19.
That's pretty awesome.
And like I said to Dr. Chape, when we were just having some of these discussions several years ago, we were at $5 million since that. I think particularly for Dr. Chape, when we were having these discussions, you know, we have this $5 million debt. And, you know, I think we all felt the same way. That was a big deal hanging over our head, and seeing this every month when I get to see this is one of my favorite things to see go down.
And as we keep paying on the principal more and more, that interest rate 2.88 keeps dropping more and more too.
Yeah.
It's kind of nice.
Our customer service survey, I think this might be, Dustin, you know.
Real quick on that, what I would say is keep in mind that we got an interest rate of 2.88. We're getting CDs at a higher rate. I don't think it makes sense to accelerate our payments on it when it's 2.88, when we're generating more revenue, at least by 1 to 2%
Right.
on the other.
Like we're making money.
Yeah.
Yeah. And the other.
Indirectly, yeah.
So we can continue to let those CDs grow, and we still have the option to use that money to pay it down in an accelerated fashion, should this board choose to. But it does make sense to me that we've got a locked rate at 2.88. It's not going to change for the term of this note. We ought to let the money work for the citizens of Platte County to get 1 to 1.5% more to have it build over time. And we still don't lose the option to pay it off early.
So back to our customer service survey. I think 31 may be one of our highest numbers.
Oh, yeah, it's not.
And I'll just kind of skip down to, we got our first So how easy, or okay, how would you rate our service? We've gotten our first 2-star.
Boo.
Uh-oh.
Haters gotta hate. I was actually here. That was me.
Okay.
Just kidding.
And whoever answered, their only comment was that we kept asking them the same questions over and over. And I believe they're a repeat customer, and they didn't really say much else. But on how easy was it to use our services, I believe they rated us a 5. And how friendly and helpful was the staff, they rated us a 5. So what they didn't like was we kept asking them the same question.
To be
about-
fair, that's common in the medical field.
That's what I was about to say.
Yeah, we always ask
And
the
you get the
same
same
question.
question every time you come in.
What is your name and date of birth?
Get your name and date of birth. Do you
What's-
feel
what-
safe at home?
What's your past medical history? I already told you 20 times. I know. Any
Any
changes though?
surgeries?
So, any allergies to medication?
Mhm.
So I do believe that they may have, who knows what questions, but they had had enough.
So with that, I would just say any changes, and if they say no, then just leave well enough alone.
But so 1 2-star, 1 4-star, and then 29 5-stars on how you would rate our service this month. How easy was it to use our services? 2 4-stars and 29 5-stars. How friendly and helpful was the staff? 1 4-star, 35 stars. What did you like about your visit? Friendly staff, everything. Kirsten was amazing. Clean and fast. The WIC staff, very helpful. Seen on time. Just everything is pretty positive as always. What can we do to improve? Nothing I can think of. You guys did great.
Stop asking
Stop
the same
asking
question.
the same question each time I come in. It should be noted in our chart. The ladies in clinical services and Paige should receive the utmost acknowledgement for their hard work and due diligence. So Cindy, maybe tell them and Paige they need to work harder. But I know whenever I read these, I just love seeing all this good stuff about staff.
Especially
So
when they name names.
Pretty awesome.
we will, and I think I've told all of you, we go over this every staff meeting and we'll meet
Awesome.
with staff on Wednesday. So I will make a point to embarrass Paige,
Person.
point out Kirsten and Paige, not embarrass them, of course, but make sure they are recognized in the meeting. Taylor?
We've had a lot of things going on this month. We've had a few different monitoring meetings and different audits. It seems like it's that time of year where everybody's kind of doing their audits and contract monitoring. So we met with someone from the state for the public health emergency preparedness contract. Lots of different meetings and things. And Andrew talked about the HVAC. Had a couple fun things this month. So as Andrew mentioned, we had the back to school fair. This year we had 751 children who attended, which included 314 families. So that was a pretty good amount. And we distributed 557 backpacks. Also had lots of different people from different organizations connecting with services. We did some vaccinations. There was also dental and vision screenings. So it's a really, really great, it takes up the whole building and a lot of the staff participate. And even Susan came and joined in the fun and she volunteered to help us out. So we appreciated that. I had the job of being an interpreter. So I was walking around with some of the Spanish speaking families and interpreting for them, which was fun until there's multiple. If someone texts me, like I'm walking through with the family, and then someone else is like, "Oh, come over here. I need you at the front desk. We can't understand." And so it was just a lot of running around, but it was good. It was really cool to see, and I think we had a lot of fun with that. We also had Chelsea Lipa, our new health educator. She started this month. So she's jumped right in. Her first week here was pretty much getting ready for the back to school fair, and I think she's enjoyed that. So had lots of good things going on. We had 113 families for harvesters this month. And for our home-based visiting, Tia has 17 clients, and she had 25 visits for this month. We're going to talk a little bit about the safe highway in a few minutes. We had 40 inspections for our general inspections, and then we did 29 mobile and food units. So in the summer, a lot of times there's people who are doing fairs and different festivals. So another thing that we had this month was the Platte County Fair, and it was the 163rd Platte County Fair. You might have been there, but they had 27 food vendors. So I went with our environmental public health staff, and we did inspections, the temporary permits for a bunch of vendors. So it was really cool to see. They worked hard. They said it was nice that this year it wasn't quite as hot as it had been the previous years, because they said last year they went and it was in almost 100 degrees and everybody was sweating. So it was a lot smoother this year. I think it was only in the 80s. So.
What did people say about the rates for the permits? Were they cool with it?
Yeah. We have some of the lowest permit fees.
They actually said that though? They actually commented on it?
Well, I don't know if they commented on it. I didn't hear them comment on it, but yeah. I mean, usually they're pretty pleased with our rates.
So I have managed several places, and I don't know that I've ever heard anything about our rates here. I have been other places where they have mentioned it, but it was because they were higher.
Sky high.
Right. We
What does a temporary permit cost?
Yeah, good question.
But and the only reason I ask is if you think about it,
50, I believe.
50. So a vendor who's going to come to county fair from wherever, they have to spend $50 in order. They have to make that back in their sales, which at a fair, a vendor, I have a sense that that is a reasonable percentage of their total net revenue.
Yeah, it's pretty common too.
Okay.
How much is it regular?
So that's what it was at Cass.
One is 100.
And it is much cheaper than like Kansas City. So
when you do a temporary, what's the time frame? You get a week, or what do you get with it?
So it depends. So this one was the duration of the event. So it was that Wednesday to Saturday, I think was what the fair was. So it was that whole event. If it's something like a farmer's market where you're coming back each week, then the temporary would count for each of those as well. So it kind of just depends on what type of event it is. But they can also get like an annual permit, and then the annual permit, they can do it at any event.
Right. That's the $100. Yeah. So wait a minute. So they hold on. So they can come back week to week to week, and it'd still be the temporary. That doesn't make.
Well, if they're gonna do multiple, so some places just come and they're just
One
one
time.
time
Yeah.
doing one event for a week or so in Platte County, and they might go to another county or another state. So they might just want the temporary one. But if it's someone who's constantly in different places around Platte County, they would just get the annual.
Okay.
So there's a picture of all our staff eating food. Just for the record, they were done with their. They actually went and paid for their food. So we don't do free samples.
Okay, sorry.
Oh, they weren't sampling it to see if there was a GI bug.
Deep fried Twinkies and deep fried butter and deep fried.
Yeah.
Okay.
They're all good. Yeah.
Okay, for my report, just a few things this month. I do have a correction. Last month I misspoke. Yellow fever actually does come in 5 single dose vials instead of the 5 dose single vials. So that was on me. So yeah, so let's worry about wastage on that right now. So
Yeah.
that's one nice little thing. One really cool thing we got to do was, so oddly enough, back in 2020, Missouri Department of Health STI program wanted to go out and do like quality assurance audits. Obviously, everyone got a little busy during that time period, so that got postponed. They started this year again last fall. They said it took about 2 years to get everyone completed. we got an email about like a week before our actual visit saying, hey, short notice, we know we're being Kansas City. Are you guys free to do an audit? Okay, yeah, sure. So they sent us information about it. We had everything prepared. We sent it off to them, and I attached like what the quality assurance actual worksheet kind of looks like, as well as a letter from Jeremy that he had sent to Andrew. Overall, summing up his words is we're pretty awesome. Like he is very, very pleased with us, like the stuff that we're doing. They actually got an email from him today. We're be a spotlight on our next STI quarterly conference call at the end of September, talking about our processes, our standing orders, and like our guidelines and protocols that help us follow what DHSS has for like their STI testing program. So I'm very proud of my crew for that, and very glad that that was such a success.
So what was specifically that because I read that they were impressed. So what do other counties not do? I guess that's the real question.
I think it had to do a little bit more with like some of the record keeping and like how they have some understanding orders and things kind of written out. Don't know entire details of like what they're all missing, but I think we just had everything ready to go from the beginning. I know when they first announced that they were starting doing these quality assurance audits, a lot of people didn't know that worksheet. They didn't know that existed. So there were some elements of that they were not doing. We made sure that we had all of us, we were doing it, and then had everything tailored to that. So that made it a lot easier for us. So they were using some of like, they're wanting to use some of our resources and things to kind of share with other departments too, to kind of help them get up to what their quality assurance standards are. So
When they do the spotlight, will they go through this like how we did it here, or is it just?
So I'll get to present, so they'll just introduce me, and then it'll be like a 5-10 minute presentation I'll get to do on the virtual call. So I'll basically highlighting like here's the information we have. I'll be sending out.
So that may help other health departments.
And we've talked about sharing documents and things in the past too. So I'm going to make our documents editable so they can send out in a package if people want to adapt them for their own things, have that readily available. Because we do provide for the medications. We give out little patient education flyers. We have little information sheets to give out to patients about what to do after you've been treated, and general safe sex practices and things like that. So,
Awesome.
but yeah, so we were pretty excited for that. Like I said, gotta shout out my team for that. And it was pretty cool of Jeremy sending the letter to Andrew.
Nice work.
Talking about our visit. So great job, nurses. Continued working on our TV case management, helping out that back to school fair and our summer safety kits. So we're hoping for the World Cup, we'd be a little busier and trying to keep all of our visitors as well as our community members safe. So when the initial World Cup started happening and it wasn't as big of a turnout we thought there was going to be, like, oh, we ordered all this Narcan and stuff, we're be sitting on it forever. No, those bags went like hotcakes. They just flew out the door. So we were pretty pleased to be able to get that stuff distributed into the community. We did have their annual financial monitoring. They did find that there were no findings identified during their audit visit. And I will talk a little bit more about some of the finance stuff for which here later on. In the memo you all have at your desk. Swope did have an increase in their numbers compared to last year. I know speaking with them, we had our quarterly meeting, what was it, a week ago? I believe. We were discussing with them, I know Dr. Jamal is planning on attending the October meeting because that will mark the anniversary of them being here 2 years. So she'll be able to speak to that and their business plans and everything associated with that. Gina did speak that they did receive no patient satisfaction surveys for that month, so that's why there are none attached to it. We did mention on the phone call our success we've had with our client satisfaction surveys and offering that gift card to incentivize people to fill it out. So that seemed kind of interesting to them, so they were going to look more into that. But that's my report. Anyone has any questions?
Yeah, I do have. So when you go to the slide that has the public health clinic board report, you know which third? Can you go to that one? It's on page
63.
63. Fast.
Go ahead, sorry.
Okay. So when you do the public health clinic services, you had STI, HIV, syphilis, 22 people, and then for gonorrhea and chlamydia, 38. Why is there a discrepancy? Are we not testing everybody for as much as we can? If they're worried about chlamydia and gonorrhea, you should be worried about syphilis and HIV as well.
So we offer all testing to everybody. A lot of them just decline having certain tests done. Also, one of the things with gonorrhea and chlamydia testing is so the STI, HIV and syphilis is just a blood test. Gonorrhea and chlamydia, we can do oropharyngeal, we can do anal, we can do
Urine
genital.
yeah. You can send a urine sample and get all of it.
So we've had multiple patients who will get all three gonorrhea and chlamydia testing as well as HIV. So generally, you're always going to see more gonorrhea and chlamydia.
I guess my question was, do they feel like they would be judged or something if they did the HIV one?
Not generally. I think most of our patients usually, we keep everything pretty private, pretty open with them, and then try to encourage, make them feel comfortable during their assessments.
So we asked if we could do it. I mean, do we
Yes,
actually?
so we offer hey, we have to know these are our services. Everything is free testing. Even when they decline to have it, we do offer remind them, hey, just so you know, this is available. Always feel free to come and get tested for that, especially before you get any new partners. It's recommended to have HIV testing at least once in your lifetime. So.
Do we have a protocol that strongly encourages if you're drawing blood to include the syphilis testing? Because syphilis for many years was going
increasing in the community,
and it wasn't being tested for. I know with the clinical practice that I work with, we pretty much say if you're going to draw blood for HIV, and you got to do the syphilis too.
So we always do those two together, they're the same test, blood vial. So they send a state. So both of those always come in together.
Perfect.
Another thing we're trying to do is we're working through some policy development, increasing some redoing some of our forms and things like that. It's kind of pairing and making more services. So for those coming for pregnancy testing, we always try to offer STI testing while they're here because especially with syphilis and pregnancy is a very important thing. There's a shortage in penicillin, so we want to make sure that they're being tested and treated appropriately. Again, we do always try to offer those services when those people are here.
Is there a financial disincentive for them to have the HIV? Are they charged extra if
Nope.
we do that?
Everything all our STI
So
testing
it's not a
free.
financial issue. It's all personal choice only.
Personal choice only.
Just a matter of how the test is completed.
Yeah. Is it, or how you engage with them to see?
And is the bicillin still almost $100 per dose?
I don't know the cost. So we get supplied that from the state through one program, so we don't have to pay for that at all. And they do have doxycycline treatments for those who are childbearing age women. So we're reserving the bicillin right now for only women of childbearing age, just due to the shortage, or for high risk clients who were afraid of not completing their medication regimen or.
To be cost effective, a thought would be, I love that you're offering the testing to anybody who's doing pregnancy testing. I think that's great. If somebody does test positive for pregnancy, those costs will be covered by Medicaid. Because as well, most of us should know, de facto, if you're pregnant, you qualify for Medicaid. Every OB is going to order all of those tests at the beginning too. So I want to make sure we're not maybe, if there's a narrow range where if we have a positive pregnancy test, are we going to go ahead and just test them all for STIs when that's going to be covered under a different budget from the state versus go? Some thought put into that to make sure we're not double dipping.
Not generally, because we do acknowledge that. We know that they're going to be getting Sigma OB and being tested for that, and we usually do inform them. It's more for those who are trying to become pregnant and concerned that way. So we always try to make sure that they're protected and just letting them know, hey, this may happen, so you'll be tested and screened for that. We have had rare instances too where partners come in and found out or coming in and just need to get tested that way.
Okay, one more question. Yeah, the blood pressure checks. So
before you ask that question,
yeah,
and I think everyone on the board knows this, but just any of the public, the board made the decision a while back to waive the fees for STI testing.
Yeah, so there should be no financial disincentive.
Yes, so I just want to point that out. And Dustin, can you talk a little bit about how that has impacted the clinic?
Yeah, so I think initially when we were doing this, it was always free testing Fridays. So Friday was just loaded up with STI testing. We'll get that now every now and then, but it's definitely more spread out throughout the entire week. We've also seen increases in testing, as well as a decrease in positivity. Not enough data out there to determine whether or not there's for sure correlation with that, but it is nice that we're offering that service. It does reduce that barrier. And then again, as I stated, like offering the gonorrhea and chlamydia for all the different sites of testing does help increase our chances of detecting disease and treating it whenever it's discovered.
And so if somebody was to come in and get HIV, syphilis, gonorrhea, chlamydia, all of that, that's probably, I'm guessing, our cost for both of those, $120.
It'd be pretty pricey. So I think when we were doing the cost, I think it was about $15 per gonorrhea and chlamydia test. So we've got about $45 there, like a $5 blood fee, draw fee for the lab, and then we charge $10 for the HIV and syphilis. So
What's our cost at the lab? Only keeping it, no reason I ask, I don't need the specifics.
Yeah.
Keeping in mind that, let's assume we do 60 total, you got 22 HIV syphilis and 38, so that's 60 times 12, that's 720 a year, and $100 for all of that, that's $7,000 we're expensing.
That's, I think when we looked at the numbers initially, it was like a $6,000
Yeah.
cost to us. And again,
I
some
have
of
to
these,
reiterate my support for that because the return on investment in a community-based organization to keep people who might not come in because of that money, that's huge.
It's probably
Because-
less than that though. Well,
Well,
I'm guessing the 22 or 22 of the 38.
but
is like-
even if it's less or even if it's
Yeah.
double,
Yeah.
I would support it even at
The
double our
ROI is
cost.
there.
Yeah, because we're
In
right
the
kicking a dead
I have
horse
to
here.
deal with
And there's certain things we don't advertise and we had discussed, like we'll take everybody, we don't care about residency. Because, some of the partners don't live here and that type of thing, and we want to test everybody that would be in Platte County, but, we're getting tons of bang for our buck on that.
Congenital syphilis exposure,
Yeah.
the cost for that in the NICU is ridiculous.
That's why I'm trying to encourage support to continue this because there's value.
Don't pick on my
You're the
words.
one that's.
Okay, quick question. The blood pressure checks, how does that actually work? So would a cardiologist or physician send them here to have it checked, or how was?
So a lot of times that happened, we were not necessarily cardiologists, but when we were in Parkville especially, we're so close to the Y. We
Yeah.
had many clients who would go there, work out, and they'd come over to there, and sometimes we would walk over there and get their blood pressure checked just out of curiosity. So it's just a service we've always offered. We generally don't get people coming. I mean, you can go a lot of places and have your blood pressure checked, like at a grocery
Pharmacy.
store, pharmacy, those places. So it's just something that we have here. We've reported on it for years, so we kind of just kept it on there.
So did we actually even do it?
We do offer it. We do if people do request. It's just something that rarely ever
Rarely.
comes out here for that. Yeah, like I said, back in Parkville, we did them pretty frequently. Here
Because
people are coming around
yeah.
for that.
Can you just talk
Yes.
about this real quick?
So in addition for us starting our new travel vaccines, we wanted to kind of promote it more and try to get more access to it. So we created a page on our website specifically highlighting the travel vaccines, hoping that it will get it Google searches to kind of identify more and be able to pull people towards the website, letting them know how to call, finding information about how to get an appointment and what vaccines they need, what we offer, and things like that. So
Is there a lot of interest in it?
we've had a bit so far. We just launched this website this week. And we're gonna work on some advertisement to try to get it out there more. And then
Is it like a once a week clinic kind of thing, or you can come in anytime and get all
anytime
this
we
done?
schedule and we can be here and we'll be able to get travel vaccines completed. It's
Let's say somebody wants something that's not on that list. We have the ability to research that for them and find the cost for some rare or unique ones because
We could, yes. So
Yeah.
they're I do have a list of some different manufacturers and some of the other travel vaccines that are there. We're kind of testing the waters now to see how big the need is before we get to some of those more rare ones.
well, you wouldn't keep it in stock, but you might on the website say other vaccines available by request.
Make an appointment and have it ready here.
And they would have to prepay for those rare unique ones because of the cost.
And that's something we've kind of discussed too, we were to start doing that, it would likely be a prepay. I know think historically that was done, and then there were like some issues where people would deny it or not come to them and having to refund them, and then you have this vaccine sitting in your fridge. And so
For those rare ones, you can't do that.
Yeah, so it's a tricky thing to balance. That's why we've been trying to test the waters with the more common ones people are requesting. So, but yeah, that is something that is on our radar and we have considered.
But there are a couple travel vaccine clinics in the area, and they are quite expensive. And we are conveniently located by the Kansas City International Airport within 5 minutes.
And the one thing we were trying to advertise a lot more too is, unlike a lot of these other travel clinics, like you have to have an appointment just to get a consult, just to talk to someone about what vaccines you may need for your travel and things like that. We don't do that. We get phone calls all the time just talking about like, hey, I'm going to Sudan here next month. Like, what all vaccines I need before I go, or I'm going on the safari. And we just talk to them, let them know, and that's kind of what we do. And that's something we even have on the website where we're advertising. We do free consults for you.
Once you're up and running, you might consider sending a letter to the new building across the highway to the FBI, because they deploy sometimes to places you have to get all of those, and I only know that from personal experience.
So the next page I'm working on is going to be an on-site services request. So that when we actually get we do occupational vaccines for businesses. So when they have all those people are trying something a group overseas, or like for missions, they need to have a church group is going, we can just go to them and like provide that service for them. Things like that.
What about like at the airport, they've got those big advertising.
Don't be stealing my
Yeah.
ideas.
That's
This is what he's wanted to do.
Don't be stealing my ideas.
And,
Where you come down the escalator,
Yeah,
you have
they have-
all this.
yeah,
That
People
was
that travel all
exactly
the
my
time.
idea, and idea stealing is my thing.
yes.
Okay.
But yeah, that's something we're looking into, and then the
Okay,
cost and
So
what that would be.
continue walking, continue, do not stop. You can
Do
say,
not stop.
Get your vaccine.
Get your vaccine,
Right here.
get your-
I hate that. You get when you walk
So,
away.
as you roll this out, who is gonna be staffing and making decisions, clinical decisions about what's appropriate at this? Do you have someone who's trained in travel medicine or has that expertise to consult? And
So everything we do is based on standing orders and like what the CDC recommends for those specific travel areas. So each vaccine set has its own standing order. We have the requirements, contraindications. Taylor, can you pull the website back up?
no, that's great. I just try to.
Because like one of the big things is the yellow fever vaccine. There are certain groups who can't be vaccinated for it. You scroll down a little bit. We do have the asterisk on there saying, hey, you do need a doctor's note in order to come here and get that vaccine, because they need to sit down with you, talk over like the risks and complications and whether or not this is right for you. So we do take those things into account. If there's ever any questions, we do refer them to their own providers because they'll know their medication history. A lot of places do require antiviral medications, which we can't prescribe because we're just nurses. But we do refer them like, hey, just contact your doctor, tell them you're going to this place, tell them how long you're going to be there, what you're doing, where you're going. And then they'll know your health history best. Like they'll tell you which one of the antiviral medications you need for your travel.
One option to keep in the back of your minds as well, I know this is kind of a brainstorming situation, is if this starts to get some traction and take off, you might want to reach out to either University Health or KU or KC, what is it?
KC.
Yeah, KCU. You may be able to get a resident in an infectious disease program and set up a rotation of X number of hours on 1 day a week that you can have a licensed physician, like a travel clinic. And if that becomes
Cool.
something that you want to look into, I'm sure that there are some of us on this board who would be happy to go and meet with these other entities and see if that's something that is a win-win.
I had to do it when I was in fellowship.
Just saying. I mean, yeah, I stole your thunder.
I also had to do STD question. So I've done it all, seen it all.
Anything else?
That's it.
Good report.
Nice.
Yeah. I'm not suggesting you're doing a good enough job on it.
No.
I'm brainstorming, throwing out ideas so that as this
Yeah,
rolls out,
it's
you can think, he said this, well, maybe he'll come help us with that, and which I,
Well, it's funny because like I think the Jackson County's under University Health umbrella too, so having like an MOU with them, that does make sense. Another community partner.
Do you know anyone that works at university?
I'd have to take off my shoes to get an accurate count. Not just my wife, there's a lot of folks down there, I know. But the bottom line is, if we can find something, if this gets traction, and we start to see that there's a lot of folks who are like, oh, I have to get a prescription from somebody, that there may be a role for that depending upon the volumes, and no program director is gonna send somebody up here for 4 hours, half a day a week, or every 2 weeks, unless we've got volume and they can get experience. So, just a thought, just wanted to be supportive of it, idea, I'm throwing them out.
I appreciate it.
Okay. Okay, so we're still waiting on our site visit agenda for our virtual site visit on September 30th.
Just remember, they need to hear you on the microphone.
Okay,
She's
I'm
doing
sorry, I
fine.
thought I was speaking loudly, but.
We got a comment from Cindy last time about certain people are really loud and she can hear us. That was myself and Dr. Kingsley and yourself. The three of us are very loud.
I bet I beat you both.
You guys are also the closest to the microphone.
Exactly.
I hear you fine, please proceed. September 30th.
Yeah, Taylor and I were able to attend the Randolph County virtual site visit, and that was really nice of them to let us come, and we learned a lot from there, very insightful, so we'll be able, once we get our agenda, to prepare accordingly. We met with our QI committee. We went through and updated the quality improvement project sheet and assigned different committee members to kind of lead some of the projects. So I feel like we got some good momentum going there. So as you know, the World Cup ended in mid-July. So up until then, our emergency response planner and our epidemiologist and our disease investigator, they were all like attending meetings and offering support. I think we're far enough away where I can officially say everything went well, nothing crazy happened. So sometimes boring is good. Other than that, nothing too crazy going on.
So October 6th is the actual on-site visit, right?
Yes,
And you needed 1 or 2 board members, or that was still up in the air?
up to 2.
Up to 2, but we cannot have more than 2.
Right, but I'm just saying that they did want board members.
Yes.
But for just a certain part of it.
And
It's
it's
just an hour.
that because we'd have to post this as a meeting,
Yeah,
Yeah.
so post
we're not
We-
allowed
they
to.
do not want it posted.
that.
And will there be like, are you going to meet with us in terms of what they have asked board members before, or what's our game plan there?
Yeah, once we get more information on, they're gonna send us an agenda with some of the areas they're gonna ask us questions
Okay.
about, and then we'll come up with a list of information. And
Okay,
So what if we called a board meeting that day and we posted that we're gonna have a brief board meeting, we have our board meeting and we all sit here and go through that?
They do not want it public.
No, if we have a board meeting that day and they happen to be here, that's fine. If we're gonna meet on for our own reasons, we won't make it public that they're here.
So I guess what I'm saying is TAB will not have it in a public forum.
Right. But if
They will not meet with you.
they won't meet with 3 of us,
No,
not.
because it'll be a public meeting and they will not meet with you in public.
oh, because we would have to be open. It would have to be an
Yeah.
open
Everything
meeting.
they do
Yeah.
is very confidential, and they don't want it to be open. They don't
Tell
want
them to take a
anything
hike. We don't
recorded.
need them.
So,
Yeah.
I'm kidding.
so your attitude,
We've done a lot of.
so your attitude about
I'm
that,
kidding, I'm kidding.
well, I'm not, because I think it's ridiculous.
Yeah.
I do not like this aspect of how they are, I think that is not very transparent.
No,
Yeah.
I said the solution to this is just you can't have all 3 or 4 or 5 at the same time.
But the
You
problem
two could
is
be
that
there, you leave, and then I could show up. And then
there's
there'd be 2.
organizations across the country apparently that
If you
do
want
not
it.
like all their dirty laundry being,
It's fine.
exposed,
It's
and
confidentiality.
so-
It's fine.
but I'm like, hey, if we're not doing something right, that's an opportunity for us to improve.
But that's us. There might
What's
be
the-
boards.
What
Health
what is
departments that
the
aren't that way.
confidential part, I guess? I mean, you're
It's
going to look for
basically-
you're not gonna be looking at patient records.
No, but it's things like you're not doing very good on this metric, or you're not doing very good at this. And there are, so not every organization is like us, where like you've seen some things we're not doing very well on. We've talked about those things in this meeting. While some organizations try never to discuss those things, they try to hide those things. They will not talk about them in public, and they're not very transparent. And so
Until names are named.
Yes.
When we made a closed session.
No, I told the solution is
I'm
just,
just,
Oh,
Well,
one could come and one
you
leave.
can't
and
do
would
it
be
by
fine.
law because it's not a closed session topic.
I
But
just think that's
you two
kinda,
could be there, you leave, I can show up.
It's weird.
So
That's
if we
weird,
really
yeah.
want to do it, we can do it
That's-
that way.
They don't allow anything to be recorded. They don't allow anything to be public. It has to be it's very private. And
So we will leave
that's
it
not
to
us,
you
that's
all to
just how
figure
they
out
do
which two,
Take turns or just two go and just tell us how it went.
or you can stand outside and tag team.
One other thing I'll say is we had a meeting with Jackson County Health Department and they recently had their initial site visit as well. And they said, so they don't have a board, but they had UH and then they also had, I think, county commission. They said that their session was only like 10 minutes long and they essentially only asked questions about if you were supportive of accreditation and just how you feel about accreditation and how you think that your health department is doing as a whole. So I don't think it's gonna be like a long in-depth conversation, unless Dr. Chape is there, but no. No. I keep joking because they kept telling us, oh, this was 10 minutes, this was 30 minutes, and I was like, you guys did like a 20-minute tour of your health department. I was like, Andrew could do like a 3-hour tour and has.
yeah.
So, but I think they essentially just want to make sure that the governing entity is on board and is in support of accreditation.
So who's the two that were going? You're going?
I was going.
And then who's the other one?
I've got it in my calendar.
So you two? That's fine. If you think something's crazy, you just call me and I'll just show up.
Right, no, I've got it in my calendar, 8:30 to 4:30.
We'll let you know the specific time.
Right, I blocked the day essentially. Because that day at 5, we've got planning.
Oh, yeah, that's it.
It won't be the whole day. It will be an hour maximum, but like I said, depending on how much you want to talk to them, 10 minutes to an hour.
So,
Right
and,
over Gladstone, I'll be 10 minutes away. Let me down.
and there's a lot, and I think you all know, there's a lot of things about the accreditation process that I think are very valuable. This is probably the one thing in the whole process that I think is, just because it goes against my whole transparency philosophy, that I disagree with. So almost everything dealing with FAB, I have good feelings about. This is the one thing that I'm pretty much, this is ridiculous.
It's
And
just odd.
it is, and even when we are trying to find out other people's, like, I've asked from the get-go, can we see other people's submissions? Can we see, like, because to me, it's all, it should be like a Freedom of Information Act thing. And they won't give you anything. Like, they are
They won't even
completely,
tell you who's going through accreditation. They won't tell you, they only tell you people who are accredited. Because like we tried to ask them, oh, can you tell us some other health departments that are, doing it at the same time we are? And they're like, no, that's confidential.
So then why did they let us go to the other county's site visit?
The other county let us go to their site visit.
So you just happened to be there.
It was virtual, it was their virtual visit, not their.
Ah.
We were not able to go to their.
Got it.
And
I
they,
mean, the question I would ask them if I was there would be, what data do you have that shows being accredited shows that you have a superior product compared to before?
now he's stealing your thunder.
Well, he's gonna ask that question, but it'd be the same question I would have. And hopefully, because we've asked it in the
They're not
past,
gonna ask them that again, because I know the answer is they have no clue.
that's what I'm saying. They hopefully have data to now after we've asked it before.
No,
Well, they don't,
They,
it is hard to
no
collect, but
intersection.
it is something that
All they
they
have to
should
do
be
is ask.
compiling.
They're taking the data, that they should have the data before somebody was accredited, and the same data they ought to get after they're accredited.
And where do these individuals come from? Out of, I understand the organization, but like, are they?
So the site visitors are all from health departments typically.
Okay,
So-
Well, so we have the main site, like person who works for Fab, and she reviewed all of our documentation, and she'll be here, and then
Where is Fab located?
in DC.
DC.
But they have people all across the country, so I think that, our accreditation coordinator is in Wisconsin. So they kind of I think they try to pair you with someone somewhat close, so the travel isn't as high, I think it probably depends. And then they either bring another one or two people who are at other health departments, so, to be additional site visitors, and they make sure that you don't know that person, because they don't want there to be any conflict of interest. And so as long as you don't know either of them, then they will do the site visit.
We've signed a contract with them, is that correct, and provided them funding under that contract? Of a copy. Because that if contract is creating a closed door, private, non-transparent situation, I'm not gonna ruffle feathers, but at the end of the day, I don't like somebody we're paying money to telling us we can't document the interaction. It is just antithetical to what I believe is in the best interest of this county's health department. Just out of curiosity, I'm gonna read it.
You know, like what Andrew said, it's about transparency and the lack of. Now, if there are other counties that are horrible, people probably should know that.
Oh, I can't wait about going to a conference. Oh, you're the health department that found Fab. That was great.
Well, how are you gonna get better, or how are you gonna correct the problems if you bury them and never talk about them?
I think it's weird they don't allow recordings, but,
I don't even know if that's legal.
Well, it goes back to what you agreed when you signed.
Oh,
That's why I want to see the contract.
So if that's what we signed, then it is absolutely illegal.
We can
You
sign.
just yell at me for signing.
No. My neighbor can bring a contract over, I can sign it that says I won't speak about their dog getting out of the yard. But if I do, is it enforceable? It's just the flavor of this just rubbed me wrong, and it's gonna allow me some time to read it, get over it, understand it, look at the context, digest it, and then I'll get over it.
Before we move on to the finance report and past Cheyenne's thing, she mentioned the quality improvement committee and meeting we had. The one thing I would like to mention is we have had multiple quality improvement committee meetings. This one was a little different in that we have staff members from different levels. So we have some clerks and supervisor that have taken the lead on some of our quality improvement projects now. And that is different than what we have done in the past. So they are setting up future meetings for things. We had a meeting this week, yesterday. And they're kind of like setting up the meeting and running the meeting, and learning some things along the way. But like, it was interesting. I asked, did you do this prior to the meeting? And they hadn't. But it's a learning opportunity for them to learn how to prepare for, like, I know they may not have felt very happy about not doing it, but it is just a learning opportunity for them to know, hey, next time I should do this to prepare for a meeting. So I think it is going to be a good process for all of these folks who are taking the lead on these projects. So Cheyenne, I thought you did a nice job of getting you're recruiting and not trying to run all these different committees or whatever they're called, because spreading it out is a much better way.
If nothing else, or not to volunteer for a committee you're working on.
That's probably something a lot of people want to do too. Finance.
Good job.
We have,
Finance, we kind of spoke about, that we talked about the tax levy, but we also, Michael Allen came back, from the retirement plan advisors and kind of went into a little bit more about their,
the historical yields of
historical
two
years,
different
yes. And
plans.
yes, and so that was very, it kind of made it more sense in terms of what was going on and what the averages are and that type of thing over that time frame. So we're going to bring some more data to you about that at the next meeting, and then we'll make
So
the motion.
basically, they were pretty similar.
Yeah.
And I think I had mentioned at the last meeting that my concern was, you know, the two plans have very different yields for the employees. We wouldn't recommend something that would not give our employees an equal opportunity to make money on their 457. And it looks like they, you know, depending on their portfolio aggressiveness, either way, it's going to be a wash. And, you know, the stock market, you never exactly know what it's going to do, but they're pretty equal. I mean, if you, and you'll see the numbers.
We're going to have the numbers.
We have a nice little chart. It's pretty much a wash.
And you said 457, isn't that?
It is the governmental version of like a 401k.
Okay.
So they're equivalent, but one is way more costly than the other.
Well, so 457 allows you.
No, between the two plans that we're looking at.
Oh, one has basically 0.5% less
Cost,
administrative
cost.
Right.
And the results are equivalent.
Close.
Right, yeah.
You know, it depends on exactly which mutual funds, but looking at, I wanted it in some kind of apples to apples comparison.
Well, and do they do coaching with the individual employees?
Yes.
They do.
Both of them do, or just the one?
It's the same
It's the same person.
Well, same person does both.
Michael Allen.
Right.
Okay.
It's
All right.
the same servicer. So it's just in one plan, he's kind of working for another outfit, and then the other, his company is actually handling everything.
And the employees know that they could have one-on-one.
People see him all the time.
Okay.
Yes.
He's coming like again in like,
September.
so,
And he met with, I know, one person on Tuesday and possibly two.
yeah. And I even wrote our new employee a note. I said, you don't need a new car. You should invest in your 450.
Well, that would almost make it mandatory. All new employees have to meet with the person at least once, just to get, at least hear that spiel about if you start investing now,
I think
20
he's
years
gonna
from
come
now.
to some staff meetings too, isn't he? Doesn't he come to a staff
He
meeting
does.
occasionally?
The younger you are, the sooner you start investing, the more the payout is at the end.
Even if it's $50 a month.
Yeah, exactly right.
Yeah.
Put $1,000 in, plus $100 a month
Mhm.
for 10 years, at 6% expected return on investment will be $33,000 in 10 years.
Easy money.
And you'll never miss it because the taxes on it, you know, offset how much you're putting in. So
It should be pre-tax, but also when you've got a 3.5% inflationary increase, which decreases the purchasing power, but if you're making 6%, you're, yeah. So it goes.
So anything, you have no,
Two.
do you have anything else that, Susan,
I did not have anything else. That's
Cindy,
it.
nothing? just need to review and approve the bill.
Anybody see anything crazy, goofy, anything? No?
Yeah.
Okay, do we have a motion to approve bills?
Move to approve bills.
Do we have a second?
I'll second that.
Okay, Susan?
Yes.
Yeah.
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
Okay. Bills are paid. Do we have any update or increased prices on immunizations? I didn't see that. No. So there's nothing, okay.
So hopefully my memo about the electrical service to the sprinkler system maintenance kit made
Yes,
sense.
you do.
Can you scroll down to
Outside
the,
of it.
and probably most of you have seen it. But as you go in and out of the eastern driveway, you can see the fire sprinkler or fire hydrant connection. And right to the left of that, as you're looking at it, is a manhole cover. And underneath that is a big pit. And it is about 8 foot deep. And inside there is all kinds of sprinkler equipment. And if you look around our building, we have a sprinkler system. And that is where that originates the connection to the building is out there. And there's a backflow prevention device. If anyone's ever seen a sprinkler go off, the water that comes out of it is really gross and terrible looking. It puts out the fire, but it,
Has there been consideration, so the pit, you need electricity to pump water out.
right,
They want $7,800.
right.
Or less, one of them is cheaper.
What about putting the backflow preventer up closer to the building if it's on pit?
That would be more than $7,800.
I did it for cheaper.
Yeah, I feel like it'd be more than $7,800.
Well, who knows?
I mean, just
It's a
changing
lot.
out that hydrant was 15,000 when we put in the new hydrant. Anyway, and it was the original building design. So the backflow prevention device, if you don't, and I know you know this, but what it does is it keeps all the nasty water from going out into the public water system because they don't like it when you contaminate their clean drinking water. They frown upon that. And so it's a very important part of the sprinkler system. Right now, it's underwater, the backflow prevention device, and that makes it go back quicker. So it's not good to have it underwater.
Will there be a warranty on the sump pump? Because those things will go bad a handful of years and you gotta spend money
That's what
to get
I
back
asked,
down.
you and I talked about it, like,
Yeah.
how do you know when the sump pump goes out?
Well, the sump pump isn't part of this work. It's just running electricity.
Like, can they put at least a little warning or something, somebody, that the alarm would go off if the sump pump doesn't work?
There's devices, yeah. So what they're gonna do is they're gonna have a sump pump that has electrical to it, that you could also put a float alarm in there. When it gets to a certain point, it indicates the sump failed.
So we can figure that out,
Yeah.
but I have to have electricity there before.
Even if you do it,
Yeah, you gotta have electricity. $7,800 for how long a run? Okay.
It's
And they-
from the room over here and boring under everything
all
out.
under the concrete to get to the other side. And the other option they said was using a light pole as the electrical conduit.
So the other option, which was like $3,000, was going through our brand new light poles and using the conduit there, which is running 277, but trying to shove another wire through there. And we've already had a problem with that wiring. And I'm very skeptical about trying to shove another wire through something that we've already had problems with. It's no longer under warranty. It would void any warranty anyway. I feel like it would just be cleaner to get nice, good electricity out there and take care of it.
Sorry, you know me, you know I have to question, but thank you.
So, I mean, at this point, I did not realize as we kind of researched it, how bad it was just to have the check valve or backflow prevention device underwater all this time. I guess I should have realized, but that's on me. But we do need to get it out from being underwater all the time, and do need to get a real sump pump on it.
So that's the issue though, is once we do all this and we clean the water out, then we got to assess if there's any actual damage. Right? Because it's
Well,
been, we've had no power to
When
this
they
the whole time
test
in the building.
when they test the backflow valve, and they have to do it annually, but you have to get it approved by the city.
Right.
But if it's functioning, it's working.
So, and it's been tested. Taylor takes care of that. That's her. If it fails, it's Taylor's fault.
But I'm just saying, that stuff's been underwater the whole, how long we've been here?
3 years.
3 years.
I
That
just
we
need
know
it
for
to
sure.
last 3 more.
Yeah. So I
That's
wouldn't be
what I
surprised if there
telling
might be an issue.
Susan. She thinks it's a great joke.
I'm just saying that don't be surprised if something shows up.
So hopefully, it is okay.
I took backflow preventer out of a pit at my building, and we went to where the water came into the building. We redirected it and we put it in a utility closet, and it's right there, so we don't have to worry about sump pumps and failures, things like that. So I wasn't sure if that was, but we've got a plan. It's gonna be effective.
So I believe at this point, that is the cheapest way to go.
It's reasonable.
And Cindy said she agrees. So Cindy's like, I don't know.
2 men, 2 days, 16 hours.
We're just,
at
we did one and I did.
$150
there's
an hour
three
per
of them.
person.
Do you know what this
What
is?
that
Good
is.
math.
We can ask more.
Plus the conduit, electrical.
Are we ready?
Yep.
I move to authorize the director to accept the bid from TIG Electric in the amount of $7,685 to install electrical service in the sprinkler system maintenance pit located on the Platte County Health Department property.
Seconded.
Okay, so in the discussion part here, so we chose them because what was specific about T? Just curious.
So they are not the ones that we're going to run through the light conduit.
Right.
Because they were the cheapest. And then there's included the boring under the parking lot and everything. And the second closest, which had basically the same plan, was $400 cheaper or something, but it did not include boring.
Yeah.
That was going to be
From Mike
extra.
Hagan.
Now, when I looked at them all, they all said that there could be extra expenses added on once they start doing the job.
If they find rock.
It could be.
It was
T,
$600.
so when
So
we
there's that.
talked, now when we talked to T, they were very, they were pretty confident. You never know until you get out there. There's always a chance. They were, I mean, some of these things are a gut thing as far as, they seemed like they were pretty confident that they can do it for that price.
The other discussion?
Yeah, there's gonna be a cost associated with putting a sump pump in, and the issue there is gonna be that thing's gonna run continuous. This is groundwater, it's not one way. So we're gonna have a pump running continuous, drawing current and pumping that out all the time. But that is what it is. just keep that in mind. I gotta get it done.
Any other discussion? Let's do the vote. Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
Okay.
The next item is the strategic highway safety plan. This is one of our annual contracts. So it includes things for our Buckle Up Kids and Arrive Alive programs, as well as our purchasing the seats and boosters. The only thing that's different about this one is we had already had the contract for the 14,546. And then the Platte County Sheriff's Department had asked for some safety goggles. Not safety goggles, sorry, the impaired driving goggles so that they could use at events to show people what it was like to be impaired, to kind of decrease driving while drunk. So they are two separate contracts, but that's why they're separate.
Will to authorize the director to sign the strategic highway safety plan contracts with Missouri Highways and Transportation Commission for the period of July 1st, 2026 through June 30th, 2027.
A second.
Okay. Any further discussion? Let's vote. Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yep.
Okay. we need a second.
So this was a last minute addition to the board packet. So it's not in your actual packet, but I did put a copy on your desk. We were alerted Tuesday afternoon that the USDA actually had some additional funding coming in that left over, so they were able to distribute it to Missouri WIC Association, and they reanalyzed our contract for the 2025-2026 fiscal year, which ends September 30th, and saw that we were allotted additional $44,240 in funding to use for WIC. So with this money, it would allow us to reinvest a lot of that money back in, like from the tax levy back into the health department and other services we provide here.
I would move to authorize director or designee to accept the amendment to the WIC Local Agency Nutrition Services contract with the Missouri DHSS for the period of October 1st, 2025 through September 30th, 2026.
Second.
I'll second that.
Okay. Any further discussion?
I just would like to mention that because you and I talked
Go for it.
specifically
Yes,
about
yes,
this, Dr. Kingsley had called me today and had said, you know, there seems to be a variance in this amount of money for WIC. And, you know, why are we losing like all this money?
Yeah, it was like,
And
how
I
much was the
said-
difference? It was like $50,000 almost. I was like, why are we getting paid less?
Like, it was almost like $44,000. And I had said, you know, we usually get a supplemental appropriation and it varies. So I don't know like how much it is, but it just varies from year to year. And it helps offset what we spend through the tax levy. Well, that's exactly what this is.
okay.
Instead of us spending the money out of the tax levy, this is going to reimburse us for monies we're spending. So I think it was, and I'd forgotten, I knew that this was going to be on here. Dustin told me. Apparently I don't listen to Dustin just like I don't listen to Taylor. And he had told me, I just had forgotten when Dr. Kingsley had called, but this is exactly what happens. So good question,
Prognosticating.
good question, good timing. Sorry, I didn't remember.
It's fine. I just felt like I finally stumped somebody here. I was like impressed with myself.
I feel like you always like that aha moment when you got it on Andrew. You're like, oh, I got you.
I was actually stunned that we were losing that much money. It's like, wow, the government strapped that much on WIC. Holy cow. But I guess we're not. That's good.
And I like being able to say the check's in the mail.
Yes. Thank you. Okay, so, we have to vote on this, yeah. We already did the discussion.
Yeah.
All right, Susan, go for it.
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
Okay, perfect. All right, and so then what, we have personnel action. There we go. Okay.
So we had to hire a new part-time public health nurse, Jenny Gooden. She started this week. she's got lots of experience in nursing. She is a former nurse manager, has lots of experience like working with like the VMC program. So she's pretty fun. We're very excited.
Is this to fill a spot that was open or is this
Yes.
added on
This
top?
is filling Jen Eater, who resigned back in May.
And that was a part-time job too?
Yeah.
Okay,
So yeah, same amount of
apples to
schedule
apples.
hours. Like so,
Okay,
it just
okay.
I'd like to make a motion that Tony Gooden has, be approved for part-time public health nurse one effective August 18th, 2026. Starting at the scale step 13 for a, starting salary at 29.78 per hour.
Do we have a second?
Second.
Any further discussion? Susan?
Yes.
Yeah.
Yes.
Me, yes. Mike?
Yes.
Zach? Done deal. All right, so any public comments? No. All right, and we don't have any executive session, right?
Nope.
Okay, so then I guess we'll have another meeting, September 17th, 2026 at 6 p.m. here at the County Health Department. So do I have a motion in the meeting?
I move that we adjourn the meeting.
Do I have a second?
Second.
Okay, Susan?
Yes.
Kim?
Yes.
Me, yes. Mike?
Yes.
Zach?
Yes.
It's a done deal. Thank you, everybody. We'll see you next month.